This video will talk about case definition of COVID-19. The first presenter is Valancia, the second presenter is Syahira, the third presenter is Nadia Hanani, and the last presenter is Syasya Farzana.
According to World Health Organization, coronavirus family can cause illness that firstly only be having common cold and then it can become more serious illness such as severe acute respiratory syndrome and also Middle East respiratory syndrome. Coronavirus were transmitted in animals and some can spread from animals to humans. COVID-19 is the 7th known coronavirus that affected humans and caused a lot of deaths in 2020. So now, we move to the case definition of COVID-19 in Malaysia. Before we start, case definition is defined as an outbreak investigation to quantify the severity of coronavirus within a population. First human case of COVID-19 was reported in Wuhan City, China on December 2019. The earliest case was linked to a wholesale food market in the Wuhan, and the initial patients were the stall owner, the market employee, and also the regular visitor to this market. Environmental samples that were taken from this market in December 2019 has tested positive for SARS-CoV-2 and further suggesting that the market in Wuhan is the first source of this outbreak. Full genetic sequence of SARS-CoV-2 from early human cases from China and all over the world shows that the virus has an ecological origin in bat populations. Besides seafoods that were sold in the market, various exotic foods such as bats, mammoths, and birds can easily be found in the markets. Exotic animals are highly susceptible as a high potential carrier of various viruses and also bacteria due to their eating habits and also their habitats. As we look to this slide, we can see that as of 21st December 2020, there were a total of 75,704,857 cases globally. From the graph shown in the slide, there were a total of 1,690,061 deaths were reported from January to December, and it is still increasing until now.
This is the reported cases of COVID-19 in Malaysia until 22 December 2020. So the total death is 438, while the total recovery is 78,393. Based on the statistics shown in Malaysia, the reported case of COVID-19 from February until September show a controlled amount of case. However, the graph showing a great increasing amount from October until December. So how do Malaysia get their first case of COVID-19? The virus has reached Malaysia in late January 2020. It was detected on a travellers from China that arriving in Johor via Singapore on 25 January. The reported cases remained relatively low and were largely confined to imported cases until localized cluster began to emerge in March. The largest cluster at that time is Jemaah Tabligh, which is a religious gathering held in Seri Petaling, Kuala Lumpur in late February. So the cluster has led to massive spike in local cases. Within a few weeks, Malaysia had recorded the largest cumulative number of confirmed COVID-19 infection in Southeast Asia, breaching the 2,000 active cases at the end of the March. And by 16 March, the presence of the virus was reported in every state and federal territory in the country. Next is the analysis of COVID-19 Tabligh cluster in Malaysia. The total case for this cluster is 42,023. The positive case reported is 34. The index case is 137. Generation 1 of this cluster is 1,143. The generation 2 is 921. Generation 3 is 236. Generation 4 is 26. And generation 5 is 12. So as we can see, there are decreasing amount of case from generation 1 until generation 5. So, how does the coronavirus spread? Based on the World Health Organization, or we know it as WHO, they state that COVID-19 spread between human to human through direct or indirect, such as via contaminated objects or surfaces, and also it spread through close contact with infected people by mouth and nose secretion. Case definition of COVID-19. It is a set of standard criteria for classifying whether a person has a particular disease, syndrome, or other health condition. The following case definition is for COVID-19 cases in Malaysia, so it can be applied locally.
There are three important things that you need to know in a case definition of COVID-19. The first one is suspected COVID-19 case. The second one is probable COVID-19 case, and the third one is confirmed COVID-19 case. Suspected COVID-19 case, probable COVID-19 case, confirmed COVID-19 case. There are two types of suspect of COVID-19. The first one is when a person who meets the clinical and epidemiological criteria, and the second one is a patient with severe acute respiratory illness. What is clinical and epidemiological criteria? The clinical criteria is when a suspect has at least two of these following symptoms. That is fever, chills, headache, sore throat, nausea or vomiting, diarrhea, fatigue, or acute onset nasal congestion or running nose. Or a suspect might have one of these following symptoms, that is cough, shortness of breath, difficulty in breathing, sudden new onset of anosmia, that is loss of smell, and a sudden new onset of ageusia, that is loss of taste. Epidemiological criteria is when a suspect attended an event or areas that associated with known COVID-19 cluster or red zones, or the suspect traveled to or resided in a foreign country within 14 days before the onset of illness, or the suspect has close contact to a confirmed case of COVID-19 within 14 days before onset of illness.
There are four types of probable COVID-19 case. The first one is an individual fits the clinical criteria and is a contact of with a probable or confirmed case, or epidemiologically related to a cluster of cases in which at least one confirmed case has been identified within the cluster. The second one is a suspected case with laboratory diagnosis showing the signs of a COVID-19 disease. The clinicians may use chest imaging to diagnose, which is by using the chest radiography, chest CT scan, and lung ultrasound. Another type of probable case is recent onset of anosmia, loss of smell or ageusia, loss of taste in the absence of any other identified cause. Last but not least, the type of probable case is when the death of an individual is not clarified, linked with the respiratory distress prior to death, and when the person in contact with probable or confirmed case or epidemiologically linked to a cluster which has had at least one confirmed case identified within that cluster. A confirmed case is when an individual fits the confirmatory laboratory examination of COVID-19 infection regardless of clinical signs and symptoms. The lab test detects severe acute respiratory syndrome, coronavirus 2 ribonucleic acid, in a clinical or autopsy specimen by using a molecular amplification test. In conclusion, COVID-19 is an infectious disease which transmits through the air and making it difficult to control the outbreak, plus causing the pandemic. A few preventive measures to fight this virus include social distancing, wearing face masks, hand washing, and many more. The treatments is focusing on addressing the symptoms while developing the drugs or vaccine to overcome this problem. Even though now the vaccine of coronavirus has been developed, the availability of vaccine in Malaysia will take time. Thus, we need to follow the SOP, take care of our hygiene and also our mental health to survive during this pandemic. That's all from us. Thank you.